Hi everyone, today we're going to start with the pharmacology of the autonomic nervous system. Before going on into the autonomic nervous system, I wanted to make a clear concept with you guys for the three most important definitions on which the whole pharmacology has been based. The first pharmacology definition is pharmacology. The term pharma means drugs and logy means study. So in simple, the study of drugs is called pharmacology. Now what does it say in the definition? In the definition, it says the branch of science which deals with the study of effect of drug on the living organism. Simply mean that if you take a drug, what will be the effect of that drug on your living system is called pharmacology. Now, the two most important branches of pharmacology include pharmacokinetic and number two, pharmacodynamic. Pharmacokinetic is simply divided into two. The word pharma means drug and kinetic means movement. So the movement of drug is called pharmacokinetic. In other words, it is said the movement of drug, which will include your four processes. Number one, how it is absorbed, whether you took it through the oral route, whether you injected it through your rectal route, whether you injected it through your muscles, intramuscularly, intravenously. Metabolism, how will it go, whether it will be broken down in your liver or some other parts. Then when it's broken down, where it is distributed. Where it's distributed, either it has to go to the central nervous system, it has to go to your heart, your lungs, and then once it has been done, how it has been excreted out. This whole will include what is pharmacokinetics. Third, most importantly, the pharmacodynamic. Pharmacodynamic divided into two portions. Pharma means drugs, dynamic means motion. So the motion of the drug within the body. Now, for example, we take a drug. It has been absorbed, it has been broken down. Now, and it has been distributed to your brain, the central nervous system, to your heart, thus your cardiovascular system, the lungs, the respiratory system. What will be its effect there? Whether it will excite the brain, it will depress the brain. That is its effect. On the heart, whether it will increase the heart rate, decrease the heart rate. On the lungs, whether it will increase the respiration or decrease. So that effect of the drug on the body parts, on the living organs, on your major vital organs, that is called as pharmacodynamics. Now, coming to our main topic, that is your chapter, that is the effect of these drugs on the autonomic nervous system. Before coming here, let's have a review to your previous classes, which you studied in first year and second year. This flow chart. First of all, as you can see, you have the nervous system. The nervous system is divided into two parts, central nervous system and peripheral nervous system. Central will include your brain and your spinal cord. And the peripheral nervous system is divided into two, somatic and autonomic. Autonomic is basically divided into two, your sympathetic nervous system and your parasympathetic. Now, what does the sympathetic and parasympathetic do is, sympathetic nervous system is responsible for stress, right? For example, you are under stress, your exams are coming up, or you have a result coming up, any type of stress, right? What changes will be to your body? What will be the effect on the central nervous system? Obviously, it will be stressing. On your respiratory nervous system, there will be breathlessness. You will be no breathing. On your cardio, heart rates, they will be overly exceeded. So all of that which is responsible in an emergency situation are called sympathetic nervous system. Then your parasympathetic, opposite of sympathetic. You are having a great time. Your result came out fantastic. You got into the university and the job you wanted. Yay! So everything goes down. That is parasympathetic nervous system. Now we all know the functional unit of our nervous system is neurons. Great. Now what does the neurons do? There are two ganglions present, pre and post. Now what is the difference in the pre and post in sympathetic, emergency, and parasympathetic, relax? So in your sympathetic, you have the preganglion, which is very short. whereas its post is very long. Whereas it's the opposite in parasympathetic. In parasympathetic, the short, which was in your sympathetic, here they will have the long preganglion. And the long postganglion in your sympathetic will be of the short postganglion in the parasympathetic. Now, the most important difference is what do they secrete. The preganglion of the sympathetic and the pre and postganglion of the parasympathetic, these three are going to secrete a chemical called acetylcholine. That is why these receptors are called cholinergic receptors. Whereas the postganglion of the sympathetic do not secrete acetylcholine, but secrete your hormone called adrenaline. That is why those receptors are called adrenergic receptors. Now we're going to study in what is cholinergic agonist. What the word agonist means? That it will increase the activity of the hormone choline. Those are called as cholinergic agonists. All right?